Stand up, fight back.
When healthcare is under attack, what do?
Stand up, fight back.
When healthcare is under attack, what do?
Stand up, fight back.
When healthcare.
My name is Marina Sacatano. I'm with the Inland Boatmen's Union. We're here today at the Golden Gate Bridge to let the company know that we are not going to tolerate their unfair labor practices. Our retirees were taken from the health plan they were in, put into a system of health care that relies on an HRA account, and the district agreed 2 years ago there'd be an increase to that account based on a formula. They told us during this bargaining session that that formula no longer applies and they're not obligated to do anything at all about that. And that is unacceptable. And that's why we're here today.
So what is this bronze plan? What exactly is that?
The bronze plan is the lowest type of health care. It's a 60-40 health care that is part of the Obamacare. So the district is blazing new ground by proposing the bronze plan when in fact there is no certainty that the ACA will require some of the regulations that are talked about today. So in preparation for what may come in 4 years, the district has proposed that we accept as part of our options a bronze plan. Our position is that the bronze plan is the beginning of the end of healthcare as we know it. We're not going to agree to it. There's no other agency in the Bay Area that has this, and so the district is trying to set policy for the whole Bay Area, and we're going to hold the line.
So who are they representing? Because other agencies...
Dennis Mulligan.
Who's Dennis Mulligan?
He's the general manager of the bridge.
And who is he?
He's an engineer that he's had this job. This is our second bargaining round with him. And as you remember, last negotiations, we ended up on strike also. And just so you know, the time before that we went on strike was in 1979. So it's a shift in management style and attack on the coalition that we are going to fight back. And they've had clear information that, you know, if they didn't change their stance, that we would be on strike. They haven't changed their stance. Eventually, we see within 3 years that there'd be no funding, so people would be paying maybe $12,000 out of pocket per year for their health care. This is one of the most prestigious employers in the Bay Area, by the way. You know, the general manager's salary is above none.
What is it?
Somewhere in the neighborhood of $260,000 plus deferred comp, all kinds of additional perks. You know, these management personnel get benefits we can't get until 30 years working here. They get them when they walk in the door. In fact, they get benefits that were taken away from us in 1991.
What benefits?
Lifetime medical, 10 years. They tell us they're all taking the bronze plan. But, you know, the other part of this is that, of course, these are not the issues that bring us here today. We're out here today for the unfair labor practice. But the other issues are that they're asking for increases in premiums, and in one case it would be 194% of our lowest paid workers. So increasing our cost sharing at a time when the district's premium costs are reducing is really about a shift in policy.
So it's cost shifting?
Yeah, it is.
What is cost shifting? What does that mean?
Well, basically, the cost of the premium, where employers have paid, you know, the bulk of that or 100% of it for years, now we find they want us to absorb some of those costs. And in this case, you know, sometimes you can understand when a company comes to you and asks for certain things, but we're talking about an employer that just got a 5-year toll increase for the next 5 years. based on a 5% inflation rate, and we'll have $138 million. If they gave us what we were asking for, which we think is a reasonable proposal, it's less than $1 million. So, you know.
So, I mean, the situation for workers in the Bay Area, it's like they can't afford to live here.
Right, exactly. Right,
what do they
exactly.
expect?
So in this round of bargaining, we're 12% behind the cost of living. And we're telling them, you know, we can't afford to live in the Bay Area. People are traveling farther and farther away to get to their jobs. So really, you know, they've got to do something, particularly when they go after a toll increase and they use a 5% inflation rate. And they're coming to the table with us, you know, looking for takeaways.
5% wage increase.
Hell no.
So they say there's a 5% inflation that they're going to add on
for the next 5 years.
No increase for the workers.
That doesn't, yeah, we're not part of it. We don't.
The workers' wages are not part of the inflation.
No. We're not sure which costs they believe are going to increase 5%, but we know they don't believe ours will.
And who are these board members?
They come from many public agencies. There's some Board of Supervisors from San Francisco. There's Board of Supervisors in Marin County, Sonoma County, Napa. All the counties that funded the bridge are represented.
So the people, if they want to support it, should call their representatives?
Absolutely.
And who are these people? What's the names of these people?
Well, let's see. In Marin County, you have Judy Arnold and Kate Sears. In San Francisco, you have Campos, London Breed, Scott Wiener.
So have these people spoken up against the manager?
You know, we're not certain. We're not certain. All we know is we were told the board will not reduce their proposal on the bronze claim. We have a website. They can go to goldengatelabor.com and sign our petition, which goes to the district to tell them to, you know, back off and, you know, give the workers a fair contract.
It seems like it's one fight after another, one struggle after another. Do you think there's a union busting campaign going on?
Well, you know, like I say, the last strike before this general manager was 1979, so that says a little something about the leadership.
Okay, and so if you don't get any results, you say that it's going to expand?
Right. And so basically, you know, we've allowed the lane workers to work to not disturb the patrons this morning in an effort of goodwill. We're really here to send a message to the district to back off their proposals and stop being unfair in their bargaining. And if this is not successful, then we'll be moving across the district, across the counties.
What do we do? Stand up, fight back. Under attack. What do we do?
Stand up, fight back.
Art Gonzalez, I'm from the Machinists Union. We're here today to, we had an unfair labor practice by retiree healthcare, and the district has decided not to honor the contract, which we put together in 2012. So that's why we're here today, unfair labor practice.
And what does it mean, not honor the contract?
Well, it means that there's provisions in the contract that would pay for retiree health care as it goes up, and they decided that the escalator is no longer viable, and they're just not going to do it. And they weren't even going to tell us until we asked them.
And what kind of approach do they have that has provoked this?
Well, it's just that we asked them, okay, what will work, and how can we put an escalator in there as the contract calls for, and they just said, we're just not doing it. We're not going to do it. And so that's just saying flat ass, no, we're not going to do it. That's what started this. Well, they raised the fares. They have plenty of money, and they are not giving us a comparable raise with the inflation of healthcare. So they're raising the healthcare issue is you know, part of what they're not looking at as CPI.
Is that cost shifting?
It's totally cost shifting. The total burden, they want to put the total burden of total healthcare on the employee, and they're using a bronze plan to do so.
What is this bronze plan?
Well, under the ACA, with the Affordable Care Act, there's 4 plans: platinum, gold, silver, and bronze. And bronze is the lowest level, which means that you have to pay more in a premium and have less health care. And that's what they're actually saying. We want you to have less health care. And in 2018, they're saying they might not fund it at all, and it'd be totally on the employees' backs. So why not offer gold or silver? Why would you go to the lowest plan of anybody in the Bay Area? No one in the Bay Area of any municipality has a plan such as this. It's low-level health care.
David, business rep for Local 665. 10 years from now, that health coverage is actually going to be completely gutted, where they're offering incentives where if you participate in the bronze plan, they'll give you X amount of money for the first year, second year, third year, which is going to force everyone to go into that health coverage, and the premiums are going to go up, the deductibles are going to go up, out-of-pocket spend is going to go up, and what's going to be left other than that, these people are going to get the increases. That's going to go all towards the health coverage. So you have children, have to go to the hospital. I mean, you're going to have to take a second mortgage. That's pretty much what it is. It's an adjustable mortgage. If you go into this particular health plan, it's good at the time, but what's going to happen 10 years from now, it's going to be a horrible plan to our members. This is what I think.
So it's cost shifting.
Oh, it's cost shifting for sure. No, it is. It's right now. It looks great on paper, but once you get down to the meats and potatoes of it, it's a horrible plan. I mean, HRAs, that's going to be gone by the time Obamacare kicks in. They've even mentioned that they're not sure what's going to happen 5 years from now when it regards to the HRA, if they're even going to receive any money. So that's why I think they shouldn't actually be able to take the plan. I mean, especially now for prescription visits, anything. I mean, you're paying out of pocket, which is right now for our members is going to be unfair when it comes down to once the contract's over in 2018, then what's going to be left after that? You're not seeing any increase at all, because all that the increase you're supposed to get is going towards the actual health and welfare. So you're not getting anything pretty much. What it is right now, it's pretty much we're striking. It's an unfair labor practice for something that happened in 2012. There were in negotiations, retirees were supposed to get a certain health coverage, and they couldn't even come through with that. So how can the coalition trust? Oh, I mean, you have they laid off some of the toll workers, and then you have also the tolls going up. You won't be able to afford health care anymore, which is the worst part. But the main reason we're here is because of the unfair labor practice. The unfair labor practice, there was terms that were negotiated in 2012, which they couldn't follow through, and that's why we're here. This is going back to terms that were agreed to in 2012. It's a way to put it out in the media where we're not going to get any sympathy from the public. I mean, they blame it more on the unions, they blame it more on the employees, but they don't take any responsibility. Who do they represent at this point? I mean, are they here for the employees, or are they here for the public, or are they here for themselves? I would love to see what the district's making with bonuses, annual salaries, and compared to what our members are getting, what kind of health coverage are they getting? Yeah, I'm a business rep for Local 665.
Okay, so you're a business rep.
I'm a business rep, yeah.
I mean, other public workers, if you take that bronze thing, then other public workers, will they face the same attack if they try to do the same thing as the public?
I'm pretty sure if they could offer it now, and then going forward, Kaiser's going to be able to say, okay, well, if these employees are taking it, let's try to push it on to other industries, which is eventually is going to escalate, is going to trickle down to their employees, and what's going to happen is PPOs are going to be gone, and all that's going to be offered are these Kaiser high deductible plans, which pretty much is the trend that we're seeing now.
So it's cost shifting.
It's cost shifting, yes,
so
it is.
You pay more and more out of your pocket.
Pay more and more out of your pocket every year. So all those increases you're not really seeing are going straight to the health and welfare.
But that's been going on for decades.
Oh, it has, but now it's. I want to say in the past 5 years, it's been going higher and higher every year. I mean, Kaiser comes in, gives an increase every year, and that's pretty much being shifted to the employees.
What's the solution?
Let the members keep what they have now, the same health plan, until when 2018 comes along, then we'll see what we have to deal with. But for right now, let them keep what they have.
Are you disappointed about Obamacare? It's supposed to help people?
You know, that's a catch-22. It benefits some and it benefits others. It's going to get rid of the Cadillac plans. I think so.
Healthcare.
It's a great health care. I mean, that's what the union's about, is offering our members good health care. And actually, eventually, what's going to happen is they're going to start getting rid of those Cadillac plants.
So from the Cadillac plant to the bronze plant.
Oh, it's caviar to spam. That's what it is, pretty much. It's a horrible plan. It's a horrible plan.